Now, if you're currently waiting for a hospital appointment in Dorset, you're not the only one. In fact, you're one of about 110,000 people across the county on a waiting list, partly as a consequence of the coronavirus pandemic. You might remember last month we brought the show to you live from the Royal Bournemouth Hospital, and I spoke on that programme to Debbie Fleming, who's the CEO of University Hospitals Dorset, which includes Bournemouth, Poole and Christchurch hospitals, and she told me about the plans to address that backlog.
First of all, we're doing all we can to make sure that everybody on our waiting lists absolutely needs the treatment. That, you know, after all this time, they're still in the same place. Is there any other way they need the help? And some have already had treatment. Then we're trying to make sure that all those who need an outpatient appointment or consultation or a diagnostic test, those are quite a lot of people. It's not all operations, it's tests and the lead up to operations. Get through that very quickly. Our staff are doing overtime. We're bringing other organisations in. We're doing insourcing, outsourcing and lots of extra work. And then we've got the Think Big project as well, which is very innovative, and I'm very excited about that, using retail space in the way we've learned through the mass vaccine, designed to do high throughput.
Retail space. That was Debbie Fleming, CEO of University Hospitals Dorset. The retail space that she talks about there has now been announced as the top floor of Beales department store in Poole's Dolphin Centre. Well, we can talk to the man who's planned, plotted and sorted this, Ashleigh Boreham, who is on with us now. Morning, Ashleigh.
Good morning, Steve. How are you?
Yeah, well, fascinated by this. It's something we think of a national first.
I think, yes, it is a national first. Certainly, using retail space and connecting it with health in the community is going on elsewhere in the country. Old department stores or old retail spaces are being repurposed to create health centres, but to work within a existing retail space and create something to deal with specifically with the outpatients and diagnostics and assessment is quite different, and I think it's a first.
Yeah, I mean, talk me through some of the way that it's worked. How do you go about converting a retail space into somewhere where that kind of diagnostic work will take place? So
we've built upon the experiences that you've seen from the Nightingale programmes, where you repurpose different buildings. As you know, down in Exeter, that was an sort of DIY store. So you know, taking these spaces and learning from those is not new. And then from the major vaccine centres you saw opening up, different places being used in a different way to do vaccinations, but for the flows of people going through in a clinical setting. So that's not new. And so we've taken those ideas and we've learned from those ideas, and then we've said, okay, let's see how we can work with our clinical teams, look at the clinical operating models that we use for outpatients and which would be appropriate that could go into a big space where we can use our imagination, use technology, and then repurpose something to create the space we need to get through these numbers, which is so important.
Let me point to that word appropriate, because some people might be thinking, well, I don't know how I'll feel about turning up for, say, a breast screening to a much-loved department store. Can you assure people about confidentiality and hygiene and those sorts of things?
Yeah, so through the planning, so we have the infection control team that are based at hospital working as one of the planning team to make sure it meets those requirements. We have to make sure that CQC inspect it and sign this off as a clinical facility. So that's absolutely, so it's governed and assured by policy. We also need to make sure that it's accessible in a safe space. It's about an outpatient clinic, and you talk about breast screening. As you've seen, in order to really tackle this really important issue, you have mobile breast screening units going into supermarket areas, into car parks. We've created a space that actually works really better for them, and there's a lot of thought gone into the design. So you're absolutely right. We can assure that our patients will be getting a clinical facility that is appropriate for the specialities that we're going to be going through in there. So absolutely, it's going to be exactly what it's designed to do, a good clinical facility and safe for our patients.
And we're thinking that this is going to be November, December time that we start seeing about 130 patients through the door each day on this site. How much of a dent can that realistically make to this pretty significant backlog?
So we've done modelling, and we wouldn't be doing this if we couldn't create the space and allowing the team to work and increase the capacity. And in some areas we are doubling or trebling the capacity and when we would normally do things, because it's the way we flow the patients. This allows us to flow patients using technology in a different way and allowing people to work at the top of their license to see as many patients. So, it's creating that space that is so important, but allowing the clinical teams to rethink and reimagine how they would see patients if they were given a complete open space and design their own models that work. And that's really important. If we didn't increase the capacity, we wouldn't do this.
Really look forward to seeing how it works, Ashleigh. Thanks for coming on to talk with us about it this morning.
Steve, thanks for your time, and we look forward to hopefully seeing you in November when we're open.
Ashleigh Boreham, involved in that project to convert the top floor of Beales in Poole's Dolphin Centre into an NHS clinic. A national first.